549-1113. Now, also, the producer of the show is T Jams. That's TJAMZ. And you can reach him at tjamsmusic.com. He does all the songs for the show, and he has a list of songs you can write lyrics to, send in messages. You can also reach him here at the Next Level Studios, 310-549-1113, 310-549-1113. He also does web design. Now, also, if you missed the live broadcast, if you're a Facebook friend, you can watch it anytime. You can tell your friends and family to watch. If not, they can also go to the healthyliving.company website and click on the previous page, and you can watch anytime. So today, we're going to talk about how to deal with COVID stress. We're all stressed, right? So I retrieve my information from the Red Cross website. It's called Coping with Stress During the Pandemic. So COVID-19, the pandemic, had major effects on everybody's life. No one is exempt from being impacted by COVID. Many of us are finding challenges that can be stressful, overwhelming, and causing strong emotional responses. Now we can learn how you and your loved ones can cope with stress. So I wanted to present this so you guys can have some tips on how to deal with stress and how to identify stress. Now, one thing you can do is get the COVID vaccines when you qualify. It's been FDA approved last week, so it's been proven safe for everyone. So encourage you to get your vaccine, as well as other members or your friends and family, because you have to protect your children, because right now at this point they're not eligible if they're under 12. So parents, you have to protect your children and be safe. Now, you can also search for vaccines, places to get the vaccine by going to vaccine.gov. That's a website. You can also text your zip code to 438-829. Again, you can text it to 438-829, or you can also call at 800-232-0233. Again, that number is 800-232-0233 to find the COVID location nearest to you. Now, for information with tip sheets and resources, it's published at the Center of Disease and Control COVID location. That's where you can get all the different resources. You can print them out if you need to pass it on. You can also get COVID vaccine help and for your loved ones, and you can be safe, and they are safe and effective. Okay, so care for yourself. What can cause this stress? Feelings of fear, not knowing what the heck is going on, anger, sadness, worry. Sometimes you get numbed and it's like you're not responding at all, right? Because you're so overwhelmed. You can get frustrated as well. Changes in your appetite. Some people eat more, some eat less. Energy levels change. Desires and your interest to do things may change. Difficulty concentrating and making decisions, especially at work when you're stressed out, right? Especially as healthcare and essential workers. So these things can happen to you, and this is typical. So don't think there's something wrong with you. This is what happens when you're stressed. Difficulty sleeping or having nightmares. I take melatonin to help me sleep at night sometimes. It's a natural method, and you can take that like an hour before it's time for you to rest, and then you can go to sleep and sleep a little bit more soundly. So you want to make sure it's uninterrupted sleep. So that's the kind of sleep you want to get that makes you healthier. It allows our bodies to rebuild and replenish. So we need to get good sleep. Some physical reactions may happen as headaches. Sometimes you get body pains, back pain. Sometimes your stomach hurts like heck, right? You may have other stomach problems. You may get diarrhea. You may get constipation. So it affects different people differently. You can even start having skin rashes. So some people get these skin rashes. Worsening of your chronic conditions, like your blood pressure may be higher. So your blood sugar may be higher because you're eating more, right? Or you're eating things that are not healthy. So these things can get worse. So monitor yourself. Increased use of tobacco, smoking, also increase alcohol and other substances. Please do not increase those different substances. Please seek help. Please talk to someone you feel safe with. Talk to your provider. Just tell them what's going on. Identify the issue. It's not a sign of weakness. It's just a sign that you need some assistance. Sometimes just talking helps. Call a good friend, or call a close family member. Because it's natural to feel these stressors. Anxiety, grief, and worry during the pandemic is forever changing. We've gone through this for almost 2 years now. Shut down, no shut down. I still think no matter what, you should always wear your mask, get your vaccine, wash your hands frequently. Please stick to that premise, because that's what's keeping us safe. We started with that safety, and we need to continue with that safety. Now, these are ways that you can help yourself and your community manage stress. Take breaks from watching, reading, listening to news. All news is usually bad. You hear about all these terrible stories, including those on social media. Social media can be really stressful because a lot of misinformation is done on social media and some of those Fox channels. So they give you the wrong misinformation. This is part of what's causing the hesitancy and the confusion about the coronavirus. So turn that stuff off. Don't listen to that. Cut it down. It's a good idea to, stay informed and stay on top of what's current for the pandemic. But don't overdo it with all these other channels, just searching 24 hours a day. Shut it down a little bit. It's upsetting. Consider limiting news just a couple of times a day. Maybe an hour in the morning and an hour in the evening, but not straight throughout the day, making that your total focus. That's just going to make you more stressful and possibly more depressed. So disconnecting your phone sometimes, and turning the television off, turning off the computers. Sometimes so many people are calling you, you have to take a break as well. So you have to protect yourself before you can help others. So you want to take care of yourself as well too. I know as women, we're supposed to be super women, but you know what? We have problems too. We can't always be the superwoman. Sometimes we need to be taken care of. So you guys take care of yourself. Men don't think we're always these super women. We need help too sometimes. We need support. We need that support and that love too. So just know, women are not super women. We have times when we need to have some support as well and take a break. So men, cook dinner sometimes. Take some of those privileges off of that your wife or your fiance. Cook sometime. Clean sometime. Give her a break. Give her a me day where she can go and do what she need to do. Or even if it's just to take a break from everything. Help out each other. Or if it's vice versa. Women help the men. So you have to work with each other to help each other out. Take care of your body. Take deep breaths. Sometimes we're breathing too fast and we're so stressed out, we're overwhelmed. Sometimes you just have to sit and start making yourself take deep breaths, because that teaches you how to slow down, how to take the stress away. So take the deep breaths. Do stretches. Do meditation. Meditation is get to a quiet place to where it's so quiet you can hear your heartbeat. And if you can hear your heartbeat, then you know you're doing a good job with your meditation. You can get some soft, relaxing music if you want to enhance that. That'll be good too. Try to eat healthy. Eat a healthy meal. Try to eat a balanced meal. You want to make sure you have 50% of vegetables on your plate. That should be every single day. 50%, yes. Not all that pasta and rice. That should only be like a sixth of your plate. And the fourth of your plate should be the meats like chicken, turkey. And make sure you're doing more bacon, fried. Stay away from fried at all. You want to do bacon broiled. So stay away from fried food, because that's adding a lot of more calories and it's not good for you. So you want to stay away from that kind of stuff. Exercise every day. Exercise at least 60 minutes a day. You can even break it up. You can do 30 minutes in the morning and 30 minutes in the evening. However you want to do it, do at least 60 minutes of exercising every single day. And you know what? Even if you feel tired, exercise anyway. Because after you exercise, you feel better. You'll get a more restful sleep, and it's good for you because our bodies are made to move. Now, stay to the end of the show, because at the end of the show, I like to do the easy motion exercises that you can do while you're lying, sitting, and standing. Make sure you get plenty of sleep. Avoid all that excess alcohol and tobacco. And one thing I can tell you about smoking cigarettes and cigars, it constricts your blood vessels. So it gives your body less flow of oxygen and nutrients that you need to get to your organ. So remember that the next time that you're smoking, that's what happens to your blood vessels. Now, avoid excessive alcohol, um, substance abuse. You know, you don't want to start using more and more drugs. That's not good either. So hold on just a second. Okay, um, so you want to make sure that you're doing those exercises and taking care of yourself and making sure that you exercise even though you know that you feel tired, but it actually makes you feel better after you do your exercises. So make sure you stay with me on the show because I'm going to show you some exercises at the end of the show. Now, you want to continue your routine as much as possible or create a new routine because some things have changed since the pandemic, right? And now some people are moving back into the offices. So you have to develop and establish a routine for yourself. You have to make sure that, even things like, if you just got the one jab for your vaccine, get the second one. Make sure you're doing your cancer screening and your physicals. Adults and children should all have physicals every single year. Okay, so parents, make sure you take care of yourself as well because some of you haven't had any physicals for many years. You need to get a physical every single year. So take care of yourself because you can't take care of others. So providers, they are doing telehealth, meaning on the phone. And if they think they need to see you in person, then they'll call you in so you can be seen in person. They wear their PPE, they protect you, so it's okay to do that. You need to try some unwinding routines, like, listen to your favorite music. You can even dance. There's dance exercises as well. Other activities that you really do enjoy. Connect with others you haven't talked to in months or a couple of years. Call them up. People that you trust, you can talk about your different situations or concerns that you may be having. They may be having the same kind of stress. This is not exempt for one person. This is happening to all of us. Pandemic has hit all of us very hard. Connect with community faith-based organizations. So depending on your church or faith-based organizations, you have to follow the same guidelines. Make sure you mask and keeping 6 feet apart. Check to make sure there isn't any outbreaks. They will have to let you know if there is, but connect with that. There's also online services for most church services that you can also watch. There's some on the TV you can watch. Make sure that, like I say, the increased alcohol and substance abuse is really going to throw you into a downward turn because alcohol is a depressant. So if you're already depressed, it's going to make you more depressed. And a lot of your medications, you shouldn't be taking it while drinking alcohol because it makes it worse or it makes it ineffective. So you want to stay away from doing excess alcohol and drug use. A lot of people have did it. I remember there was a guy who told me he became an alcoholic after the pandemic. Well, we got to get him help. And I gave him some numbers and contact, and I'll be giving that to you in a little bit. So talk to your friends, check on them. Don't think that they're okay. Call them and see how they're doing because some people are not okay. That person that used to be super strong, maybe not that strong as they are now. So don't assume that people are okay because a lot of people are not okay. Contact your healthcare provider. You want to participate in virtual programs. Make sure you take and keep all your prescriptions current. This is very important, especially for medications and asthma kids. Make sure their inhalers are all current and not expired. There's a little black area on the inhaler. You can look to check the expiration date. So make sure everybody has at least a week amount of medication in case we have to shut down. You have enough. Make sure all your medications are not expired. So you want to continue to take care of yourself and take care of your children. You can call the National Drug and Alcohol Treatment Referral Routing Service. This is for drug and alcohol. You can call them at 800-662-HELP. Again, that's 800-662-HELP. That's for the National Drug and Alcohol Treatment Referral. So this is about alcohol or substance use. So if they're not, they'll be able to refer you to wherever you need to go based on whatever substance problem you may have. Don't be too proud to ask for help. Now, this has impacted everybody economically, right? Some people have lost their jobs. So some helpful resources to contact for the economic impact. You can visit benefits.gov to find government benefits related to unemployment, assistance, healthcare, and food and nutrition. Again, you can visit benefits.gov to find government benefits related to unemployment, assistance, healthcare, food, and nutrition. You can also call 211 for your local resources. 211, just like 911, but 211 to find local resources. Or they have a website as well. You can go to the website by going 211search.org, O-R-G, or you can go findhelp.org. So again, on the website is 211search.org or findhelp.org to search for local resources online. Now, a lot of people have they're not able to have food regularly or enough food regularly. So there's sources for your local food bank, and you can go to findingamerica.org/find-your-local-food bank. So again, this is for if you need assistance with food. Finding America all together. Finding America /find-your-local-food bank. So this is how you can find different ways to find food. You can also check with your local churches as well, because they have contacts with food banks as well, and sometimes the local churches will have food banks. Now, care for your child. This is very important for the parents. It's for your whether they're small or whether they're teenagers. Don't assume that they're older that they can take care of themselves. No, they need you even more. So don't forget about your teenagers. They all react in different ways, but they model us. So if they see us working more efficiently, if they see us to where they can ask questions and you can answer the question, then they'll be more comfortable. If you're the model. So if they see you wearing a mask, they're going to wear the mask. And have your children practice wearing a mask at home to make sure they're safe at school. Because why? Because you have to cover your nose and your mouth. So you can't have your mask on and it's under your nose. And we see this a lot, right? Even still on some of the news, people have it under their nose. No, you have to cover your nose. And then these are K95s. So you also take your fingers and smash here to make sure you have a good closure. It should not be under your nose. So you have to wear your mask properly. And they recommend now, instead of having the regular just cloth mask, non-medical mask like this, they recommend that you really have either K95 or N95. Why? Because look, there's gaps here. So it's airborne. So it can get in to your nose and mouth even though you have it on. And along with the cloth mask basically, if it's really thin, it only protects the person that you're next to from getting COVID from you. So this will only protect them from getting it from you. And if you notice, if you get it wet, then it's not good anymore. So you have to have several layers of thickness if you're going to wear a mask. Or if not, then you need to wear N95 or K95. That's the new recommendation because of the Delta variant. So I just want you to realize that. So you have to support your children. Sit with them at dinner time and ask them, hey, how you doing? And this will stimulate conversation. This is a great time to answer the kids' questions. And you want to help them understand, because you don't want them to find out from one of their peers, because they're going to get the wrong information. You want to make sure you keep your child with the current information. But remember, they have stress too, so you have to watch them. If they have more crying, or if they're more irritated, slamming doors that they never did before, or breaking things, children have stress. Behaviors like they return to old behaviors, like they wetting themselves, or they're wetting the bed, they're having accidents. That's stuff that they have already accomplished already, but because of the stress, they're reverting backwards. So just know, if that's happening, then you need to talk to your child, because they're stressed out about something. If they have a lot of worry or sadness, you know your child more than anything. So unhealthy eating habits, like they eat too much or eat too little. And make sure you sit with them to make sure that they're not eating too fast. And parents, you have to do this too, because there's a lot of parents that eat too fast. So you have to eat slowly, because if you're eating really fast, you're going to eat 2 to 3 times more than what your body really needs, because you're eating too fast. Because it literally takes the brain time to tell the stomach is full. So slow down, parents, if you're eating too fast. Remember, you're the model for your children. Now, if you're not eating too slow, sit with them and encourage them to slow down. If they're already overweight, because we do have an epidemic in obesity, have them drink a water first. You sit with them and have them eat slowly. That will help them with their food. Make sure they're not overeating. Sometimes they may get irritability, agitated easily, acting out, throwing things, having temper tantrums. Teens do the same thing. They coming home late, or they going out and you told them not to go out. They're stressed. So you need to sit with them and talk to them and ask them, hey, what's going on? Their performance in school may be less. We know there's some performance problems because of when everybody was doing virtual. So we understand that some people didn't have true access the way they should. But now we're back to school. So what's important now is to check with them still, because this is new. They got to go back with masks. They got to social distance. They still have to do their homework and their assignments. So talk to them about that. Avoid the activities, that they used to love in the past. They're not interested. Just like the same symptoms you may have as an adult, the child can have it as well. Some teens may start smoking and using drugs and alcohol. So check on them. Smell their breath. Check their rooms. See if there's something going on, and start talking to your children. Because you're the parent, you need to see what's going on with your children. Ways to support your child. Answer questions, the true questions about COVID. Not your personal biases. Answer the true question. Give them the facts. Hopefully the parents are getting their vaccines. If they haven't, with FDA approved, now they can get the vaccine. Take your children to get their vaccine so that they're safe. We just had a 4-year-old that died last week. 4 years old. She went back to school and now she's gone. So they can't be vaccinated at this time. It's up to the parents to protect their kids by teaching them proper mask wearing at home, so when they go to school they're ready, and for the parents to be vaccinated. This is what can happen to your child if you're not vaccinated. Okay? Also, reassure your child that they are safe. Let them know it's okay if you feel upset. Share with them how to deal with their own stresses, and how they have to learn from their mistakes. We all make mistakes. Don't beat them up about it. Teach them about it. Teach them how to cope. Teach them how to deal with their stress and their anxiety. And parents, if you're having problems, go seek help from your provider. It's nothing wrong with seeking out help for anxiety, depression, or anything like that. Because you know what? There shouldn't be any stigma attached, because if the brain's not functioning well, the rest of the body won't function. So the brain has to function well for the rest of the body to function. So I want you to know that. So forget about this craziness about not going to see a mental health provider. Yes, we should. Whenever you need it, you need to take care of that. Limit your family exposures to the coverage of the pandemic, social media. Kids have phones, even the young ones, right? So you want to know what they're watching. Take the phones. Limit the screen time, TV time, phone time, computer time. Make sure they're not getting all the wrong messages, and make sure they're not getting overwhelmed from the messages, okay, to decrease their stress and so that they're not frightened, that they think they're going to die. If so, you got to teach them and let them know what's going on, because they need you to spend time with them to educate them so they know. Try to keep them with the same regular routine. I know schedules are close, and it's a change from the summer and going back to school, but be patient. It may take a couple of weeks to get them back in the routine, but just keep encouraging them. And then on the weekend or in the evenings, do fun, relaxing activities or board games, or things you can do together like scramble, or anything you can do that's relaxing to take things off their mind, right? That will help. Increase activity. You want to make sure that your kids don't get overweight, because then they can get diabetes, they can get high cholesterol. I have kids, that a child that's 10 that has, his cholesterol is 223, but he's also very overweight. He's obese. So I had to go there and teach the parents about diet. So watch your children. Make sure that they're not, you don't take a normal child and put them into a child with diabetes or any other medical problems that they don't need to have. Okay? And you should have them eat their fruit instead of drinking their fruit. No sodas. Sodas has too much sugar in it. Watch the bread, because the bread breaks down into several teaspoons of sugar. So you have to really manage their portions. Sit with them, teach them to eat slowly, have them drink a glass of water before they eat. And usually if they get exercise, they sleep better. Get them on a set pattern, and they have to know, hey, this is when you got to have your shower, your bath, brush your teeth, your pajamas on, and you go into bed. So get them on a fixed schedule. Also, have them connect with, your other family members or their friends. They can talk to them on the phone. There's Zoom. A lot of families Zoom, and they can interact with their family, or you can FaceTime them. Get creative. There's a lot of electronic methods that can increase communication. So go ahead and do that. Spend that time with your child. You need to talk to them, meaningful activities. If you're in a crisis and you need immediate help, you can always call 911. Now, I just want to remind the parents that have children that are mentally ill. Make sure you stay there. You let the police know if they show up. Your child is mentally ill or have mental health issues. Explain it to them so there won't be any unnecessary injuries, or they get shot and they die because the police don't understand what's going on. So if you call them, you need to let them know what's going on, so then they can be patient and nothing happens to your child because you did call 911. Now, you can also call the DCFS hotline, Department of Children and Family Services. Here in California, it's 800-427-8700, 800-427-8700. Now, in other states, it's called Child Protective Services, so you can find out what your local number is. For the National Suicide Prevention Lifeline, now this is important. Talk to your kids. They do get depressed. So talk to them. Know where they are. If you don't know what to do, then you can call the National Suicide Prevention Lifeline at 800-273-TALK. 1-800-273-TALK. And they do have a Spanish line as well. The Spanish line is 1-888-628-9454. 1-888-628-9454. That's for Spanish. Now, we've been a lot of domestic violence because people are all together at home all of a sudden, right? Some dads may have lost their job, or some moms may have lost their job. So all this financial stress and uncertainty. So sometimes it leads to domestic violence, meaning it gets physical. Hopefully you don't do that. But if you are in a situation where you're getting beat and attacked, then the domestic violence hotline is 800-799-SAFE. Domestic violence hotline is 1-800-799-SAFE. So please call that number. If you're not sure what the number is, you can call 911 and they'll come out and they'll help you as well. But don't be in an environment where you're getting beat and attacked all the time. I want you safe, I want you healthy, and I don't want you injured, and I don't want you to die. Because some of the domestic violences can lead to death. So I want you healthy, I don't want you injured, I want you safe. So again, that number is 1-800-799-SAFE. 1-800-799-SAFE. You call that number so you can be safe. The National Child Abuse Hotline is 1-800-4A-CHILD. 1-800-4A-CHILD. That's the National Child Abuse Hotline. National Sexual Assault Hotline. National Sexual Assault Hotline is 1-800-656-HOPE. National Sexual Hotline is 1-800-656-HOPE. And for the Veterans Crisis Line is 1-800-273-TALK. 1-800-273-TALK. Okay, so please come back, and after the break, we'll do some easy motion exercises. So stay tuned. Okay, see you in a few minutes. Okay, hi, and welcome back, everyone. So we're going to do some exercises. Like I said, You can do these exercises while you're sitting in the couch, lying in the bed, sitting or standing. So we can start with the sit-ups. You can put your back next to the armrest or the back of the bedboard, and you start from here, and you always hold your abs in every time you do it. And then when you get more advanced, you can go further, do the same thing. You can do 3 sets of 10s, and then you can go all the way when you get really good, right? Hold your abs in and come all the way up, right? Okay. Now, let's give you some more exercises you can do on the floor. Okay, so since we're here, you can do, have your palms down, and you can do what we call pelvic lifts or tilts, where you just lift up, and you can do it 3 sets of 10, or you can hold it for 30. Isometric is holding your abs in, holding your muscles in. That's isometric, or you can do 3 sets of 10. Now, when you get more advanced, you can hold yourself up, but then slide down slowly. That's when you get more advanced. You have to be stronger to do that, right? So again, right here, where you're holding it up, you get more advanced to work it harder, hold your abs in, but move down very slowly and hold yourself up. That helps to build your core, okay? Now, since we're here, another thing you can do for this inner thigh right here, this muscle, where your legs rub together, you can just open your legs and close them, like this, right? So that'll help for that. You can also do lifts while you're here, where you can hold your abs in, and you can lift your legs up, right? Lift your legs up. You can't go all the way, then go where you can on your lift, low, medium, all the way until you can, right? Remember, hold your ab in, and it's always 3 sets of 10s, right? Now, you can't do both. You can do one at a time, right? Either way go, it's still exercising, right? And then get your arms in it and work your arms at the same time. You can do that as well, right? So there's always different things you can do when you want to do some exercises. Now, another thing you can do while we're here, you can go to the side. So you can, whether it's a little bit more, or all the way. It depends on where you are and what you can do. So you can go one leg. This is also a good stretch at the end of your workout to stretch out your back as well. And remember, it's both sides. You have to do both sides. So I'm doing one most of the time, but you have to do both sides. Now, when you get a little bit stronger, you can use both your legs. You can go where you can go, middle more, until you can go all the way, right? So to the point to where you're going on both sides with both of your legs together. This is good for right here. It's really good for that. Those love handles, right? So this exercise is very good for that. Now, you can also straighten your legs out, and you can do the regular scissors on the ground, right? Just move it over. Or you can start lifting while you're doing it, right? Depends on how, when the variations, when you get stronger, right? So you can do that as well. You can also lift your leg, right? You can do them individually. You can do that. And then you can do together, low, medium, then all the way, right? So it just depends on where you are, where you're gonna do your exercise. Now to get more resistance, if you're up, then you wanna do it slowly, lowering it, right? Slowly. That's good for your abs, right? Slowly. Okay, now another thing you can do, you can get a resistive band. You can put it around your knee. And it does work. I'm telling you it works, people. It really works. I'm showing you different ones so you can rotate your exercises because it's important to rotate. So this one, you can put the band on your knee for resistance to make it harder, and then make sure that you roll your hip forward. So put your arm here, that's how it reminds me. And then you can stretch your leg out and you can do lifts, right? And then you can make sure your hip is over and go to the back and do the same thing, right? Okay, that's for that side leg right here. That's good for that. Okay, remember, don't cheat. You gotta do both sides. Now, another one that's good for the back leg, your buttocks and that back fat, right? The back fat. So you turn over on your tummy. You can turn your head sideways, so you breathe, and then you just raise your legs up. If you have knee problems, then you might want only go like halfway, but you'll know because you'll feel the pain. So you go where you can go, whether it's half or a quarter, or all the way up, right? This is good for that back fat, the back of the thigh, and the buttocks, right? Okay, for those cottage cheese moon craters. All right, so that's that. Now we're gonna do some standing. Whew. Okay, so now we're gonna do some standing exercises. Whew, it really works, I'm telling you. Make sure you stay hydrated. Now, for standing, in order to get your core stronger, you got to be able to hold yourself up for like 30 seconds. So, if you never did it before, then make sure you have something solid that's not moving, because you're not going to be strong enough to hold your balance. So, what you want to do is hold yourself up on one leg. So, you should be able to do that for 30 seconds. Now, you shouldn't be doing all of this because that's no good, right? You want to just be able to get to the point where you're using your buttocks and your thigh muscles to hold you in place, and then rotate it with the other leg. So until you're strong enough, then make sure you have something to hold on to. Or if you can't do it at first, then don't worry about it. I couldn't do it either, so don't feel bad. But just get going, so then you'll get stronger to where you can do that. And then that means your core is getting stronger. Now, another thing you can do is find something solid that's not going to move, and you can do your side lifts, whether it's low, medium, or higher. Remember, it's both sides, okay? So you can do that. Now, another thing, as far as being strong, these are like what I call standing sit-ups, right? Because you're standing. But you're going to go down and you're going to touch the ground. So if you have back problems, you have to make sure you move slowly so you don't go down too fast. So you want to make sure you have your feet apart, and then you're going to go down and you're going to touch the floor, right? If you can't touch the floor, then touch your knees. You can touch your calves or your ankles or the top of your foot until you get to the bottom, right? This is a good warm down exercise at the end too, to stretch your back out, or if your back is hurting. Now, you can also pull in a little bit, and you can mix it up by going to the sides for those love handles on the side, right? So, you're going to go down, touch the side, come back up, middle, and you're going to go to the other side, right? Remember, if you have back problems, you got to go slow to prevent back spasms, okay? Now, okay, let's do... Okay, so we can do like running in place. You can get you some weights where you can run in place, right? Because you want to work your arms. But if you don't have the weights, no problem. You can get some water bottles. You can get some canned fruit or vegetables or whatever. They're weights. So you can add that to your workout, so you're not missing out, right? Right. Okay. Now, another thing is the squat. Okay, so for the squat, if you have knee problems, then you want to squat. So you want to have a wide base, and then you want to stick your butt out. So I'm going to do it on the side so you can see what I'm talking about. So a wide base. So you want to sit squat, meaning stick your butt out first. That takes the pressure off the knees. So you want to put your butt back and squat, okay? And if you can't go all the way, then go where you can go until you can go. All right. Now, let's do some sitting exercises. Whew. Drink your water. And then I want you to rotate different exercises because it's good to change them up. Okay? So while you're sitting, you can still do the same thing while you're lying, sitting, or standing. You can open here and you can just close. Oh, this is just a great exercise for this inner thigh. And it's a great exercise too that I found that if you have swelling in your lower extremities, this is very good to do this too. So exercise does help. No matter what you're doing, it does help. Now, you can also do the same. You can do sitting, what I call sitting sit-ups, right? So you're going to do straight down. You touch the floor, right? It's not as hard on your back as standing because you have a little longer way to go if you're standing, right? So this is an easier way, and same as the couch sit-ups, to do the sit-ups. But this, I think, is easier than the couch or the standing because you're just going right down, right? So you should be able to go right down. And if you can't, then go where you can go. Go to your ankles, you can, right? Or go to the top of your feet, or then eventually to the ground, right? Then you want to make sure you go to the side, right? So closer, and you go to the side. So you mix it up, right? Okay, now, also with this one, you can do the classic scissors, right? Where you just bring your legs up and you crisscross them, right? You can do that. You can also do what I call 3-point leg lift, right? Where you can lift, put it out, bend it back, and then put it down. Lift, out, bend, back. Lift, out, bend, back. So you can do those too. Now you can also march in place while you're doing, meaning you're pushing up on your toes. You're sitting down, but you're pushing up on your toes, right? So I call them marching in place. So, but you're sitting, right? But you're still exercising, right? So then you throw in the arms while you at it, right? Right. Now, you can also just lift your legs, right? You can lift your legs as high as you can get them. And then the stretch, you can do that too, to stretch your back out. You know, in the end, you can do that. But for now, you can, if you want to just lift, you can lift your legs, right? Lift them. And then you can get to the point where you can lift them together. Remember, you got to always hold your abs in. So you want to lift. You start out low with both. You go higher until you can go higher. And you can hold it for 30 seconds for isometrics, right? Or you can go 30 times, 3 sets of 10s, right? Right. Okay. Now, another thing you can do, this is a resistive band, right? So you can put your hands in, you can tie it off in the middle and put both your hands in there. And you can put one hand down, face down on your knee, and the other one, you can just do curls, right? So that's curls, but it also supports your arms, so it's not putting a lot of stress on your shoulder for people like me that have shoulder pain, right? And then you rotate it with the other arm and do the same thing. Now, if you want it to be harder, then you just move your legs apart, right? So then the band has to be moved further apart. So then that's going to give you more resistance for your arms. If that's too much for you, then you can just bring it back in until you get a little bit stronger, right? Okay, so that gives you several different ways. You can start closer, right, and do it down here to be supported. Then you can move it apart, right? So your arms have to be pulled out a little bit further. And then you can go even further, right, for more resistance. So, it just depends on where you start and if you're used to doing exercises or not. So that's something you can do with that. Now, another thing I want to show you that is really awesome. And you can do this while you're watching Power or any favorite show, right? And remember, I used to couldn't lift this, so, it takes time because this thing is heavy. But just like anything else, in time, things get easier for you to do, right? So the cool thing about this is a cute. There's other peddlers on the market, and it gives you a resistive knob to change the resistance to make the workout a little harder. It also gives you a monitor here to count your steps. So you could be watching Power. Now, if it's too much on your knees, if you have knee problems, you'd have to push it out a little bit. So it's not so much. So your knees are not coming up so high, right? Now, the other good thing about this peddler, you can go backwards. So you should change it up a little bit. Do some backwards, do some forward, right? While you're watching your favorite show like Power. And then you can get your weights. And you can be pedaling and working your arms at the same time, right? Isn't this just wonderful? And just think about it. While you're watching Power Book 2 or Lois and Superman or Supergirl or whatever is your favorite show, halfway through, that's 30 minutes, right? And if you do the whole show, that's a whole hour. So just think how easy it will be if you did it while you're watching your favorite TV show. Now, I advise you to wait at least 30 to 45 minutes after you eat, right? Because your food, you don't want to throw up or get sick. So, but anytime after that, there's no excuse not to exercise. Even the children like this pedal. They love it because they like to speed it up. Or, you can go as fast as you want. Or you can go as slow as you want. It's up to you to increase your activity, right? Now, the most important thing is that you take care of yourself. So, I wanted to let you guys know that there's some other numbers I wanted to give you too. So there's the elder care locator. If you have an older parent that you need to take care of, it's called elder care locator, and you can reach them at 1-800-677-116, 1-800-677-116. And then also for the LGBTQ community and including youth, you can call them at the Trevor Project. They have trained counselors specialized for the LGBTQ community. And you can call Trevor line, it's called Trevor's Lifeline, at 1-866-488-7386. Again, that's Trevor's Lifeline at 1-866-488-7386. You can also text START to 678-678. Again, you can text START to 678-678. Or you can even connect online. So the Red Cross has a lot of different downloads for management tips, and they come in all different languages. Spanish, they have Haiti, French, Chinese, Tagalog, Korean, Vietnamese. They have a lot of different languages that you can print, and you can get the information for the tips and the helpline. So I want to make sure that you guys are taking care of yourself, and it's nothing wrong with knowing that you need to take care of yourself. So I want to make sure you really have the National Suicide Prevention Lifeline, and that's at 1-800-273-TALK. 1-800-273-TALK. And again, if it's in Spanish, it's 1-888-628-9454. 1-888-628-9454. Now that's the crisis suicide hotline. So that's very important that you talk to your teams and let them know, see where they are. Because if you don't talk to them, they're not going to tell you. They feel embarrassed about it, so you need to talk to them. Now, in order to keep your immune system healthy, you need to take your vitamin C every day, at least 1,000 vitamin C. You need to take your vitamin D. They even have proven treatments where they give people who have coronavirus in the hospital vitamin D, and it helps to make them better in some cases. So they've always had research now where it's been proven to help deter the COVID if you take your vitamin C and your vitamin D. Now, also to build your immune system, you can take zinc, 10 milligrams. I recommend you take it with food so it doesn't irritate your stomach. Now, another thing that helps build your immunity is almonds and cashews. They help build your immunity as well as avocados and blackberries. They help do the same thing. Now, for the berries, I recommend that you wash them and put them in freezer bags and freeze them so you can use them as you need to use them without them going bad on you. So the other thing that the virus doesn't like is acid foods. So it doesn't like lemons, it doesn't like lime, it doesn't like oranges, it doesn't like pineapples, grapefruit, and you know what? It doesn't like avocados either. So avocado is just a good kind of vegetable right now to have. It's going to build your immunity, and it has good acid content. So those are some good things right there. Now, also keep cleaning your products when you bring them in from the store. Keep washing your hands with the mail. You can buy these little water bottles online. It doesn't cost much at all. And you put 1/3 of bleach in there and the 2/3 parts of water, and you have a bleach spray. So you don't have to be wondering about using a lot of bleach and buying a bunch of bleach bottles. That's one way you can do that. You can also get antibacterial soap and soap up your towel and wipe things down as well. So that's another way you can save money, but it also cleans for you. Make sure you clean the frequent touch items in your home, doors and knobs, especially in the bathrooms. Make sure you keep that place clean. And I do recommend that you get either an N95 or a K95, because the Delta variant is really a problem. There's more available N95, and it does have the NASHA approved on it, which is National Institution of Occupational Safety and Health. It has it on the actual N95, so you know that it is approved to keep 95% of that virus away from you. The K95 is a better mask than the regular non-medical mask, because this one can also fit closer to your face, and it's more protective than this mask. If you want to add an extra layer, you can put your K95 on or your N95 and put this mask over it. You can do that as well. But with the Delta variant, the new recommendation is that you move to either a K95, preferably an N95. So these are now more available online. The K95s have been around since the beginning of time, so they're even more available. So I want you to protect yourself. Also, There is research that states that the virus can be contacted through your eyes. So I recommend that you get fog-free goggles because they protect your eye. They can't get into your conjunctivis, which causes the pink eye. So it can get into your eye. It protects you from the side as well. It gives you eye coverage. You want to make sure you get the indirect or no vented, not the vented. Vented will allow more flow of the virus into your eye. So if you want to be fully protected, then you need to put on your N95. And we're, for hospital staff, we're fit tested. So we know what size N95 we wear. So, because we're fit tested, right? So you put that there. And I even put that. And now I put, where's my K95? Well, I usually put my K95 over the top. You can do that too as well. Or you can put the blue one over the top. Give yourself extra protection. It doesn't hurt, right? So, and some scientists do recommend you double mask, right? And you want to make sure the important thing is you take your fingers and you fit it here around the nose. And then also you wear the goggles, okay? So that's what I recommend. So, if you want to reach me, you can contact me at healthyliving.company. And there's my website. You can also reach me here at the Next Level Studios at 310-549-1113. And also the producer of the show is T-Jams, TJAMC. You can reach him at tjamsmusic.com. You can also reach him here at the Next Level Studios at 310-549-1113. 549-1113. Okay, so stay safe. Take care of your mental health. Watch your children. Take care of them. Get your physicals. And I'll see you next time. Okay, stay safe. Bye-bye, everybody.